thank you. So we're moving on to the next demonstration, which is facial injectables. That's a huge topic. But we're doing this tonight to kind of roll out a product that I'd like everybody to consider, at least learn about. And it's called Renuva, R-E-N-U-V-A. And you can probably see it if you go over and talk to our group at Musculoskeletal Transplant Foundation. Renuva is a filler, but it's different than anything you've ever seen because normally fillers are hyaluronic acids or PLLA or PMMA, different products. This is a natural product, and it comes from the Musculoskeletal Transplant Foundation because it's human tissue. Renuva is what we call a adipose matrix. And what that means is that it's harvested from cadavers, fat. And it takes a large amount of fat to make a small amount of product. But what Musculoskeletal Tissue Transplant Foundation, or MTF, does is they process this tissue in a way that removes all the fat cells. So it does not transmit disease, you can't be allergic to it, but what is left behind is the fat matrix. It's the kind of the framework, if you will, that the fat lives in. But in that framework are important things like growth factors and other platelet-rich functions that, in a sense, will grow your own fat. So think about the applications for that. You know, we're all trying to get rid of fat, but this actually grows fat, and it's your own fat. But it's very, very natural as it does that. It doesn't overgrow fat. It really stays within the genetic code of where you're putting it. So it has a lot of applications in terms of injecting it into the body, into deformities, into defects. But from a cosmetic standpoint, it also has a lot of applicability as well, especially in the face. And we're going to talk about that today because one of the areas that it really helps is when you start to thin out along your cheeks. Now, there are other products that we can put in that are called what we call collagen inductors. What that simply means is that it grows little scar tissues around microspheres, things along those lines. Works fine. But this is natural and it's fat. And it will grow your own fat. The nice thing about fat is unfortunately most of us know, it's hard to get rid of. So it's permanent. So once we grow that fat, it's going to stay there. Now, any injectable that we use in the cosmetic arena, we're reluctant to tell you it's permanent. Like anything else, it's going to differ in terms of weight gain and weight loss. So Renuva is really coming onto the cosmetic scene, and I think it's going to be the next hot thing in terms of injectables, not only in the face, but anywhere in the body. But as you're going to see, it has a lot of applicability to the face. Now, it comes in a powder, we rehydrate it, and we inject it in. The difference here is that it's not a filler in the sense that you're going to see immediate results and keep those. What we're basically doing is we're depositing the product wherever we want, and then over the next 8 to 10 weeks, she's going to see that plump and start to plump with her own fat. And it's really, really cool as it works out. So we're going to utilize Renuva this evening in her cheeks. Now, we also notice, and it's Cheryl, right? Cheryl, yeah. Couple of other interesting things about this patient in terms of trying to even things out for her. She had a little bit of a skin cancer on her upper lip that was removed, but it's made her upper lip come up very nicely, actually. But the left side is not even with it. So we're going to use some injectables there to try to even that out a little bit better for her. And then what she has said is she doesn't like these kind of dark, deepened nasolabial folds. So we're going to inject those as well. Sorry. So, no sudden moves, right? Since I'm a little taller, I'm going to bring you up a bit. So we're going to start with the Renuva. Now the Renuva is injected like most injectables, but we're going to use it in the hollows of her cheek, right here. There we go. So We'll clean her up. Now, we've already put some numbing medicine in her, but that's going to really numb up the skin more than it is anything else. So we're going to go deeper, and we're going to get into this area right here. The only down part about this is we have to use a little bit of a bigger needle. And I'm going to position your head just a little bit this. I'm going to give you a warning before we do anything here. So I'm going to do 1, 2, 3, and it goes in. So we're just going to spread it around. You okay? And it's going to look a little lumpy, and it's going to look a little bumpy. And then what I'm going to do, I'm going to ask you to open your mouth. Now everybody's like freaking out because, oh my goodness, I don't like that big lump, right? That lump is just water. So I'm going to spread this around a little bit just like that. I'm going to put a little bit more in, a little bit more distally. Open up. It's a very quick injection. And I'm trying to get that product wherever it's going to do the most good. So we're done that side. Now, right away, you're going to see an improvement, right? That improvement's going to go away. It's going to go away in the next 24 to 40 hours because the water's going to resorb. It's going to look like nothing was done. And then over the next 8 to 10 weeks, you're going to see it plump back out. I'm going to switch sides. I'm going to have you turn your head over. That way, give it a little bit of a different view. Real quick, boom. You all right? And once it goes in, how are we doing? Open up. Okay, so I'm going to rub this around. Looks brutal, doesn't it? It's terrible. Okay, relax. So she's going to feel a little swelling there. That's from the water. That's going to go away in the next 24 hours. And we'll just massage that in. Now, the cost on Renuva is not a whole lot different than what you'd normally be seeing with hyaluronic acid fillers. It's very similar in cost, but the benefits are completely different. It's a very, very natural material. It's easy to inject, and we can put it, it's great in cheeks, and also the backs of your hands. You know how when you get older, your skin gets a little thin, you start to lose volume in your hands. It's fantastic in the back of the hands. Obviously, that's a little veiny. We use a blunt little needle that goes in there to avoid all the vessels. Okay, we'll switch sides with you again. So, we've got the Renuva in her cheeks, and I'm not worried about what they look like now. Again, that's all going away. I like to massage for about 5 minutes or so, just to make sure that the product is where I want it to be. Now, and the other reason it looks lumpy and bumpy in the cheeks is because when I inject in the cheeks, and I'm injecting it through a sharp needle, I over dilute it. I put extra water in it, okay? It doesn't matter. I can put a bucket load of water in it. I just want that material to be where I want it to be. So she looks a little puffy here. That's because I put extra water in it. So now we're going to do her left upper lip, because we want that to just maybe come up a little bit to match that right side. The other option would be to come over and revise the scar on the left. That would be also another option. Now, we don't need a lot. So we're going to use Volbella, which is a hyaluronic acid. Very thin. It's nice for the lips. Oh, it's already wet. Good job. Okay. I want you to put your head back and lean against that. Okay, so if we were to even this out, I'm going to flatten that out. I'm not going to go right in the vermilion border this time. I'm just going to come underneath here. And I'm going to do little by little till I get it up to where I want it. You okay? This has numbing medicine in it. We're getting there, a little bit there, okay. Now I'm going to come over lateral a little bit for her as we look at the sides. Now, if I want to just turn her vermilion border up a little bit, I'll come up under there. But right now, I'm trying to volumize her red lip because that's what's going on over on the right side. So we're getting closer. It's much easier to inject both sides and get them even than it is when you're trying to match the other side. That's why they made me do this injection. Look at me. So we're getting close. I see a little bit if I'm going to match it. Again, we just keep going. And it looks like I'm injecting a lot, but I really am not. A little goes a long way. Is it going to be exact? Probably not. But we're going to get her a lot closer. So this is challenging, and we'll just keep adding and adding until we're happy with the way we look. But you can already see the difference in terms of how she's looking over here, which really is starting to even her lip out a lot. So now she can put lipstick on without having to overdraw one side or look uneven. So I'm looking at her lip and I'm saying, okay, the only place that I need a little bit more is this little hollow right here. and that fills it out beautifully. That looks nice. And I am going to go a little bit under the vermilion border right here, just to get a turn up. Yeah. I'm also going to help out just, and is it okay if I go down the lower lip here? Just a little bit, just to even things out a little bit. There we go. Very nice. Okay, so it's not exact, but it's super, it's a lot closer to symmetry and much, much less noticeable in terms of her unevenness. So the last part of this we're going to do is a nasolabial fold. She asked us to kind of plump these up a little bit, here and here, which we're going to do. And we're going to use Velour, which is another product. Same type of product. It's a hyaluronic acid product. Nice. It's a little thicker, a little bit more structure. See, that's softening up already. That looks nice. Nobody's going to recognize you today after we're done here. So we're going to come up right underneath this line. This has local anesthetic in it as well, so it gets numb really quick. And you can see it blunts that line. Is it going to go away completely? No, but it's going to really blunt it very nicely. And I'm kind of going under the line, but we're also going on both sides of the line, just so you don't have what looks like a big lump of filler right there. And like anything else, we're going to massage it a little bit. Now you can also see a hollow right here. And we're going to fill that in nicely. Beautiful. Come around, we'll do the other side. Very little bruising, if any. Same thing. March right up. Then we're going to fill out this little hollow down here, just like the other side. Lip is a little swollen, but that's going to relax. And I have a little bit of extra product that I'm going to try to maybe dampen this little laugh line here a little bit. Cheryl already said, do whatever you think I need. So we're going to, look how that just blunted that beautifully. So, good. So what I'm going to do is I'm going to instruct her to massage those cheeks tonight, a couple minutes maybe before she goes to bed, just to smooth it out. All those bumps will be smoothed out most likely by morning. So again, Renuva is brand new well, it's not brand new to the market. We've been using it in reconstruction for a long, long time, but it has so many great cosmetic uses. But remember, when you see Renuva injected, you can't think about Renuva being like every other filler material, because it just isn't. All we're doing is depositing the material. The material will then take care of itself. So she'll feel, like I said, she'll feel a little lumpy and bumpy for about 24 hours, and that's going to improve. Lip, not exact, hard to match that, but it's certainly a heck of a lot closer. Now, smile for me. And it evens out beautifully when she smiles. So, very, very nice. So I want to thank Cheryl. She's been a trooper, right? A lot of needles, a lot of injections. Everybody, when I was injecting the Renuva, went, but that's okay. That's what it's going to look like. It's just water, okay? The water will go away, and it'll be fine. So good. What else you want to do? No. Good, thank you. And we'll be around for questions about Renuva or anything else you watched just now, because I know we're running a little late. We're going to try to stay on time. And I think we go to Cool Sculpting next, which will be cool. You'll get a chance out here. It's going to be back there. But if you don't want to all crowd around that small space, it'll be up on the monitor. So thank you.